You have often spoken about the challenges of healthcare cost, and you've said that an institution like Fortis has an important role to play in it. Can you tell us how? And do you think medical insurance and the availability, better medical coverage today can help?
Well, it's starting to already, right? If you think back again, my first round here, at that time the insurance penetration was in the mid-single digits. Today we're in the double digits in terms of penetration. So I think certainly the access and availability, as the insurance sector in India matures, 8-9 years ago, we didn't have very much history, so actuarial data was very limited. That's obviously our database continues to grow. We have a lot more information available to us today in terms of patients' histories, predictability, some expectation on what might happen to people. So I think the insurance segment is going to grow quite substantially. I think from an affordability perspective, I think that that we are working on partnerships with the government. There are multiple locations in India today where we partner with the government to provide low-cost packages for different procedures that might be available. But in and of itself, even at Fortis, for example, I mentioned earlier about breast cancer. We're running 50% off on mammograms because we think that's important for us to be able to do. And so I think what you can look for is for us to take the lead on the whole awareness perspective. I think that's an investment that we have to make. I think from a screening perspective, you should look for us to be making an investment, and we are doing that, and we'll continue to do that. I think that when you start getting into treatment, I think we need some support, collaboration with the government to help us so we can do that. And what I can tell you clearly, and I speak on behalf of Fortis, but I would tell you that just about anybody sitting in my chair would tell you, is that if we can partner with the government, we're certainly willing to make an investment in that direction as well. I just don't know that the private sector can carry the entire burden. It doesn't anywhere else in the world. So I spent a good bit of my life in the US, and when you have programs like that, it's a good chunk of it is funded by the government. And I think we need some support from the government, but I would tell you that organizations like Fortis, we're prepared to do our part, and we will, and we are, and will continue to do so.
The government is doing a lot to make alternative therapies available to the people under Ayush. Does Fortis see any role in it? I mean, it is really helpful in towns and small towns and rural areas.
We are listen. We're all starting to dabble in that space right now. It's new even for the government. It's new. Having said that, there's an entire unorganized sector which is quite significant and large in India today in that space as well. So I think we're dabbling in it. Do I think we'll do more of it as we go forward? Absolutely. Is there clinical evidence that supports doing some of these things? Yeah, very much so. So I think that we're starting to dabble in it. We're exploring different things. We have one vertical in our organization called Mamma Mia, and Mamma Mia is actually about natural healing. It's about yoga and the effect that yoga can have on an expecting mother. So I think that things like that, but certainly homeopathic, Ayurvedic, different types of treatment, we're certainly looking at it, dabbling in it like anybody else. It's not significant yet, if you ask me to quantify it, but I think it'll grow. I don't know that it's not ever going to be more than clinical medicine, but I certainly think it'll have a role to play, and we'll certainly be participating in it.